Good afternoon, and thank you for joining us today for our panel webinar, Housing First, a Key to Avoiding Homelessness and Institutionalization. My name is Sid Pickern, and I work with the Community Living Policy Center here at the Lurie Institute for Disability Policy at Brandeis, and we're honored to be co-hosting a panel with the Bazelon Center for Mental Health Law on such an important topic. Before we introduce the panel, I'll be going over a few of our accessibility features and logistics. First, we have simultaneous American Sign Language interpretation available. To view ASL interpreters, click on the interpretation button that looks like a globe in the Zoom toolbar. It's usually at the bottom of your screen. A small menu will appear. Click American Sign Language to view ASL in a pop-out box that you can make bigger and smaller, as well as move around your screen. Depending on the device you are joining from, you may need to click on the button that says More with 3 dots in the Zoom toolbar to view the interpretation button and other Zoom function buttons. We also have closed captions available. To turn captions on, click the CC button at the bottom of your screen. To ask a question, use the Q&A function on your screen. The Q&A button looks like a speech bubble with a question mark in it. We will have a few minutes at the end for questions. If you have any technical issues, please use the chat to message the hosts. And then this webinar is being recorded and will be available on our website and YouTube channel a week or two after the webinar. The contents of this presentation was developed under a grant from the National Institute on Disability, Independent Living, and Rehabilitation Research. NIDLR is an institute within the Administration for Community Living, Department of Health and Human Services. The content is solely the responsibility of the authors and does not necessarily represent the official views of NIDLR, ACL, or HHS. The Community Living Policy Center at the Lurie Institute for Disability Policy is a national center that conducts disability-led research and works to advance policy to improve access to and quality of Medicaid, home, and community-based services for people with disabilities and older adults in the United States. The Judge David L. Bazelon Center for Mental Health Law is a national advocacy organization that provides legal assistance to individuals with mental health disabilities. Through litigation, public policy advocacy, education, and training, the center works to advance the rights and dignity of individuals with mental health disabilities in all aspects of life, including community living, employment, education, healthcare, housing, voting, parental and family rights, and other areas. Ensuring non-discriminatory access to community-based services has been central to the center's mission and focus. So we're really fortunate to have our moderator and our 3 panelists with us today. We'll be hearing from Jennifer Mathis, who is the Deputy Director of Bazelon Center for Mental Health Law. Previously, Jennifer served as a Deputy Assistant Attorney General in the U.S. Justice Department's Civil Rights Division. Jennifer also played a key role in coordinating strategy and briefing when the Olmstead case was heard before the Supreme Court and has litigated numerous community integration cases before and after. She also played a lead role in securing passage of the Americans with Disabilities Amendments Act, among other accomplishments. We'll also be hearing from Sam Sembris. Dr. Sembris is the creator of the Housing First model, an approach grounded in the belief that housing is a fundamental human right. As the CEO of Pathways Housing First Institute and a clinical community psychologist, he has helped shape homelessness policy and practice across the US and globally. He is the author of two influential books and was named one of Time's 100 most influential people in 2024. Marcy Thompson is the Vice President of Programs and Policy at the National Alliance to End Homelessness and brings more than 20 years of experience developing and implementing federal homelessness related policy. Marcy has served as the Director of Policy Initiatives at the U.S. Interagency Council on Homelessness, where she led the development of All In, the federal strategic plan to prevent and end homelessness. Her experience includes various roles at HUD, where she worked collaboratively across the federal government to develop policy that sought to codify national best practices. And then Rochelle Ellison is a speaker and advocate at the National Coalition for the Homeless. She's a woman with lived experience of being homeless with co-occurring disorders for 17 years and is now in long-term recovery. Rochelle is also a graduate of Housing First. She is a member of the Interagency Council on Homelessness. She works with the People for Fairness Coalition, the Rhonda Whitaker Streets to Life DC, pardon me, and she is also a housing liaison for Serve Your City, Ward 6, Mutual Aid, among other roles. Rochelle stands in the gap for those still unhoused with continuum of care needs. Thank you all so much for being here, and now I'm going to hand it off to our moderator, Jennifer Mathis.
Thanks so much, Sid. So our panelists today are all fantastic sources of information, and I'm excited to participate in this webinar. I'm just going to give folks a quick overview of what the panel will cover. So in recent months, federal housing policy has changed dramatically and taken a turn away from some of the proven approaches that had been used for many years. The most significant example of that is the federal government's new rejection of Housing First, an approach that has been used for more than a couple of decades now because of its success, actually several decades, because of its success in enabling people with disabilities to maintain stable housing and live in their own homes and communities. While Housing First was championed for many years by one administration after another, by administrations of all political stripes, and first promoted on a national scale by George W. Bush as housing czar, in recent months we have seen unprecedented attacks on that approach. Those attacks appear to be based on misunderstandings about what Housing First actually is, what it looks like, and what the evidence shows. The purpose of today's webinar is to provide some basic education and information about Housing First. We will look at Housing First from a variety of lenses, including that of a service provider and researcher who actually developed the Housing First approach, that's Sam Sembris, of someone who has lived in Housing First housing and also Housing First that did not follow that approach and has been an advocate for years on these issues. That's Rochelle Ellison, and of someone who has worked with people around the country to help develop and ensure effective implementation of supported housing, and that's Marcy Thompson. So why don't we start with Sam? So Sam, you are the person who pioneered the approach of Housing First. Can you tell us what Housing First is and how you came to embrace it?
Good afternoon or good morning, depending on where you are. And thank you, Jennifer, for inviting me honored to be part of this panel. Housing First was developed in response to homelessness when the traditional responses were not working. We started having a lot of homeless people on the streets in this country many years ago in the early 1980s when public housing was defunded essentially from a policy that has never been rekindled from the Reagan administration. And we began to see people on the street. And most alarmingly, people who appeared to have mental illness or addiction or health problems, generally not doing well, the visible homeless, the most vulnerable people that we see. And that group, by the way, is only about 20% of the overall homeless population, people who are doubled up or in shelters or living in their cars, we don't see, but they're actually a much bigger group. And all of the policy focus and funding is all about, what's happening on the street because that 20% represents for the public what homelessness is. 90% of the public, when you ask them, who do you see as homeless, they would describe the person they passed on the street that day. So this group gets a lot of attention. Why are they there and how can we help them leave? The system that was developed before Housing First, I would describe as a staircase or 12-step system. It's based on the assumption that because people looked ill, looked symptomatic, or looked like they were using, that the reason they had become homeless didn't have to do with the larger economic forces. There wasn't affordable housing, their benefits weren't sufficient to get them back into housing if they lost it. But the assumption was it was their illness that got them homeless. And so therefore, they needed treatment first. And this treatment first approach required shelter, sobriety, psychiatric treatment, and housing eventually. It was like step by step by step. And that's the system actually that I was working in. In fact, it was a more dramatic version of it. And it relates to the executive order today, which is calling again for ending crime and disorder on American streets and a big push to have people removed involuntarily from the streets because there's this assumption that people are refusing treatment. And this gets back to why Housing First got started. We were initially, before there was Housing First, for those people who couldn't make it up the stairs, I was actually working in a program that would take the person involuntarily to Bellevue Hospital. And then sadly, a month later, I would see them again on the street. And after this endless repetition, we decided to do something else. And what we started to do is now called Housing First. We didn't call it Housing First. So let me say that the first thing about Housing First is not really about the housing, although, of course, housing is a key part of it. The key thing about Housing First is changing the way that we relate to people who have psychiatric disabilities and homelessness. It's about fundamentally changing that relationship. And that change involves going from telling people what to do or insisting that people do a certain thing to asking them what it is that would help them. It's a shift from placement to request, from compliance to self-determination. And so the person then, when we engage people in that way, and we say, how can we help you? Almost uniformly, universally, people say, isn't it obvious I want a place to live? And that's how we got to Housing First. People were choosing housing as the first thing that they wanted. And of course, once housed, we would provide robust home visits and other supports to help them address whatever needs that they wanted in the sequence that they wanted. So Housing First is uh, housing that's usually paid for by a voucher, either choice voucher or project-based voucher, a robust support system, and a program philosophy that is person-centered, meaning that the person continues to determine the sequence of things that happen to them. The program, compared to other programs that require, treatment, sobriety, compliance, and all of that, has minimal requirements, but it has two very important and non-negotiable requirements. One is that you must be able to meet the terms and conditions of your standard lease, be like every other tenant in the building and pay your rent, and you must agree to a home visit. That's what creates the success of the program, the support services that come after housing.
Thank you, Sam. So, Rochelle, I want to turn to you. You lived in Housing First Housing in Washington, D.C., and before that, you had also lived for quite a few years in housing that had a different approach, this treatment first approach that Sam was describing. Can you tell us a little bit about what your life was like in the earlier housing and how it changed when you began living in Housing First Housing?
Absolutely. When I was in housing eventually is what it was pretty much called. I didn't fare so well because you had to meet expectations and requirements of an organization or another human being. And my story starts with early childhood trauma. So I wasn't given the opportunity, and it's person-centered. So I wasn't given the opportunity to work at it at my pace. They wanted me to speed up the process of dealing with all these traumas and mental health challenges that I had and the substance abuse issues that I had. And instead of giving me the opportunity to try to work through things at my own pace, I was trying to work at their pace. So it wasn't very empowering. It didn't give me free will decision making. It didn't let me move at a pace that was healthy for my mental health, or anybody or any area around me. There was nothing really gained from it because I always failed at that attempt. When I got to DC and I got housed by Pathways to Housing DC Housing First, it gave me the opportunity because I remember in the 17th year of being homeless with co-occurring disorders, I had a moment of clarity sitting on a park bench and said, if I just had housing. And within 6 months, I was approached by the outreach team of Pathways to Housing DC. And with the Housing First approach, my whole entire life changed. It's housing first. So I got the foundation. And then you kind of realize, hey, I have a foundation under my feet. I can make different decisions. They're not going to take my keys regardless, and they're going to work with me. And I had an ACT team. I had a wraparound team of people that I could call and turn to. So now I had a safety net and I had a support system. This was working for me, and it was very empowering for me to be able to choose. And then the other thing was that my name was the only name on the lease. Pathways to Housing didn't go on the lease with me. So it gave me a responsibility, which was also empowering at the same time, and them allowing me to move at my own pace. I was homeless for 17 consecutive years. And this year, I'm in a house for 17 consecutive years. I'm the milestone of being a house. But I'm a woman in long-term recovery. They gave me the choice to be able to make that decision on my own when I could deal with each trauma at a pace. And going into a 12-step foundation system gave me the opportunity to get better. And now today I'm a woman in long-term recovery. So the Housing First model absolutely worked for me. And as you know, I graduated from the Housing First model. So it absolutely does work. And it's given us more empowerment individually to make decisions when we're ready and not when someone else is ready for us to make them.
Thank you. And you said, I just want to follow up for a minute. You said you were homeless for 17 years before that. And so when you were offered and given housing that was this kind of housing eventually model or how treatment first model, like what happened that you ended up homeless again? I mean,
What happened is that I didn't meet those individuals' expectations. And the expectations are created by me with Housing First.
right?
But, they're being supportive. Like I said, the safety net and they standing by you no matter what mentality. And then you have a whole ACT team of people surrounding you. Eventually I moved to community support. And then eventually I didn't need the wraparound services and I didn't even need the community support. So eventually I asked to be terminated with Pathways to Housing. But that was only when I was absolutely knew I was ready. It wouldn't be unhoused again.
Right. So in other words, when you didn't meet their expectations, then you lose the housing.
Exactly. If you don't meet their expectations, their rules and their regulations, then you're put back into the homeless population. And as I just stated, I have 17 years of being housed now. I'm matched against my 17 years of being homeless because of the housing first model giving me the opportunity to, they were client centered, they were person centered. There was in it, one size does not fit all. So they work with individuals at their own pace, on their terms, but it absolutely does work. I would not be who I am today without housing first model being there for me and me being able to accept the housing first model. I definitely wouldn't be doing all the things I'm doing today because they gave me a chance to heal and to get clean and to get mentally stable and baseline at my pace. And it was still there for me.
Thank you. So Marcy, I'm going to turn to you. Before you were at National Alliance to End Homelessness, you had worked at HUD and saw the shift that HUD was making toward housing first principles and away from older approaches. Can you talk about how and why that shift happened at HUD and what the thinking was behind it?
Sure. And first, I just want to thank Rochelle for sharing that testimony because uh, that was beautiful and greatly appreciated. And that's the thing that inspires so many of us to do this work. So Jennifer, I want to actually back up even further than when I was at HUD. So when I first started in many years ago in this field, I was a behavioral health case manager with what used to be called Shelter Plus Care. And so kind of got to know the HUD homeless programs before I even started working at HUD. When I came to HUD first as a MSW grad student and then later as an employee, the programs at that time, and really I'm speaking specifically about HUD's Continuum of Care program, and you've kind of already heard this in some ways. Back then, the programs were set up to really look at project level outcomes. So it was how successful clients were at meeting certain milestones. So what ended up happening was if that was tied to your funding, a lot of providers were what we would refer to as creaming. They were picking the clients that were going to be able to succeed most so that they would be able to show better outcomes. People that were not successful would probably be removed from the program again so that they could continue to meet those outcomes. I can remember early in my time at HUD, Sam probably doesn't even remember this. We went on a tour of Pathways to Housing DC, and I remember leaving there, and one of uh, my leadership at the time, I remember feeling like, oh, this is just a wild model. Like it's really interesting, but I can't imagine the federal government like fully adopting this. It's just, so out there. It was like the conversation at the time. Um, but then a few things happened uh, in sequence. So Barack Obama was voted into office. We also saw uh, Congress reauthorized the McKinney-Vento Act, which put a greater emphasis on permanent supportive housing and folks with higher levels of need. The Affordable Care Act battle was underway, which was really critical in this conversation. The USICH released its first ever federal plan, which was heavily based on research, was heavily based on community input, and that really included and incorporated housing first as a key strategy in the federal plan. That plan drove the federal response for the next 7 years or so in terms of how the federal government responded to homelessness. So within, succession, we saw the VA first formally adopt Housing First into its homelessness programs in 2013. Even though providers around the country had been doing Housing First for a long time, HUD incorporated it into its annual funding opportunity for the first time in 2013. So it wasn't mandated, it was really incentivized. But because it was so well understood, um, and because the change in the authorizing language in the legislation, uh, no longer looked at project by project outcomes, it looked at system level outcomes, suddenly providers had the ability to, or maybe felt freer, to be able uh, to shift the way that they were doing the work, right? And so, I think that what we saw in the other big important thing that I should mention, because this is related to what Rochelle talked about, because of that creaming, because for so long those projects were serving folks with fewer needs and fewer barriers to housing, we started to see chronic homelessness emerge. Like the term chronic homelessness emerged during the Bush administration because not suddenly, but we started to recognize that there were people with really high service needs that had been outside for years, that had been homeless for years, that were not getting the housing. So over the period probably between 2010 and 2016, with all of these shifts, we also saw an increase in focus on people that were experiencing chronic homelessness in permanent supportive housing with the adoption of Housing First. And we saw year-over-year reductions during that period of time in across homelessness and particularly in chronic homelessness. On the VA side, on the veteran side, we have seen absolutely the most progress across the board. I think it's really important to mention the key distinction there is the VA is a healthcare system. So for VA's homelessness resources, they have a healthcare system that is matched with a dedicated housing resource where they're able to meet veterans that are experiencing homelessness where they are and able to provide whatever types of assistance and support at whatever level is needed. For everybody else, the Affordable Care Act, needless to say, didn't exactly turn out, I think, the way that we had envisioned. And so even as housing resources increased, it didn't increase at the level in which we needed. And we haven't seen the same increases in the services or match for people experiencing homelessness. And so I think that there has been, when you look at individual successes where Housing First uh, is the practice that is used at an individual level, we see the greatest success than any other approach that's taken. I think when we look at systems and at homelessness response systems as a whole, we see Housing First being blamed for increases in homelessness and whatnot, when the reality is communities just don't have the resources they need to respond. So I will just say, in terms of the government response, I think it was a full-scale adoption in recognizing what the evidence showed us, believing people. I mean, listening to people, seriously, like Rochelle, who were telling their stories and telling us what they needed, was huge in that adoption and really led to a lot of the success that we saw during those years.
So, Marcy, I want to stick with you for a minute and let's talk about what has happened with current policy around Housing First. Sam mentioned an executive order. Maybe you can tell us a little bit about what's happening and what the rationale has been for that change.
Yeah, sure. So, I mean, I think that it's important to um, contextualize all of this in uh, there were a lot of systemic shifts that were happening over the last 10 years. So homelessness was declining all the way until 2017. And then since then, homelessness has started to rise. Housing First became a very easy scapegoat. It became well, we're seeing higher numbers, and therefore it must mean that this approach is failing. What it has overlooked, and Sam already really touched on this, is what we sometimes fail to look at is the number of people that are becoming homeless every year because of the lack of affordable housing and because of all of these other systemic challenges has outpaced the number of people that homelessness response systems have the resources to support. And so we've seen this rise in homelessness. When the first Trump administration came in, They definitely backed off of the federal policy around housing first. The VA did not. The VA continued during that period to use the housing first approach consistently over all of these years. Um, so what we've seen in the last, 8 years in particular, and then most recently during this administration, is a real backlash on this idea that because homelessness is going up, homelessness response systems are failing, programs are failing, and because so many programs identify as housing first, because the federal government adopted housing first, it must be housing first that's the problem. So last year, Sam mentioned the Ending Crime and Disorder on America's Streets, which was an executive order that came out in July. Absolutely, hands down, the most harmful federal policy that I have ever seen in my career. And it very explicitly directed federal agencies, HUD in particular, to change grant structures and to make changes in the way that programs were operated, to back away from housing first and to move towards more punitive approaches, to embrace involuntary commitment as the way to solve problems. And so we have seen that be integrated into HUD's programming over the last year, or attempts to incorporate it into the programming over the last year, and wanting to move towards a treatment first approach, which we've done. I mean, I think that the biggest thing here is we've tried exactly much of what they're proposing. We know it was ineffective, and now I think they're wanting to take us back to an even more extreme than where we were 20 years ago.
Thank you. And I just want to clarify before we move on. I think the closed captioning captured something that you said, perhaps incorrectly, because I I think when you were talking about the advent of housing first on a federal level, the rate of chronic homelessness decreased. The closed captioning transcript said the rates of chronic homelessness increased, and I think you said decreased. So just
Correct. Yes.
clarify.
From like
Okay,
2010 to 2016, we saw decreases in every subpopulation, including chronic homelessness. Yes.
thank you.
Mhm.
Um,
But it is
so
what the federal government is saying.
yes, that is true. So Sam, turning to you, you are not only a clinician, a clinical psychologist, and supported housing provider, but also a researcher. And you did some key studies showing the effectiveness of housing first in early years. And so I'd like to put to you what is your take on the evidence that's being used currently to argue that housing first is not effective?
Well, uh, we do have randomized controlled trials showing that the program is much more effective than treatment first, 80% compared to 30 or 40%. And the thing that I think that is being used to say that the program is not working, and this is not one study, by the way. There was a recent review from the Center for Disease Control, CDC, in 1920, where they did a meta-analysis of 26 randomized controlled trials, not only in the United States, but in Canada and in France.
2020, I think you mean.
2020, sorry, 2020, thank you. So 26 studies in 2020. And anyway, the thing about the administration is correct to point out that homelessness is growing. And so then but the misleading part is to say that it's because we have housing first that it's growing. In fact, it's growing because the number of people falling into homelessness because of the unaffordable housing, racism, poor wages, the structural features that continue to create homelessness have not been addressed. And so we have more people falling into homelessness than we have going out. We do not invest very much in homelessness in this country. HUD, which for some reason is the only organization that addresses homelessness, gets 0.8% of the federal budget, $10 billion out of a $6 trillion budget. We are investing 0.8% in homelessness. So we're not investing in programs, Housing First or other programs, to address homelessness at the scale in which it exists. But the misleading part of this is to say that we have homelessness because we've had housing first policy, and so it's not working. I think that's not only disingenuous, but kind of purposefully misleading to go back to not investing in permanent housing. We have made significant policy errors in addressing homelessness, having homelessness be only part of HUD, because as I said earlier, you need services as well. And as Marcy correctly pointed out, the only successful program we have in this country that has actually addressed homelessness to scale is the Veterans Program, because Congress agreed that veterans are a worthy population. We're going to invest in them, and started 10 years ago with the count. One thing we do well in the country is count number of people who are homeless every year. As imperfect as it is, we had 80,000 veterans at that point, and Congress allocated 80,000 vouchers to HUD for the rent, and then money to the VA for services. When Housing First is done properly, it works extremely well. We've had a 56% reduction in veterans homelessness. Over 100 cities have ended veterans homelessness, and the number continues in that direction. What we've also had, though, is HUD insisting that everybody do housing first, insisting that we only address the chronic and the most vulnerable, and only pushing that as a matter of priority, but never funding the increase in services that are needed to address this population. So then you have people in a 30, 40 unit building or hotel with very little case management support, and it's a disaster. There are police calls, there's drug dealing, the place is awful, and yet it's being called a Housing First program because there's no treatment required to get into it. It's a mislabeling and a misrepresentation of Housing First, and people then point to this and say, "Oh, you see, Housing First isn't working." If you're not implementing the model properly with the right level of support, you're not going to get the results that Housing First delivers. So those kinds of things on the implementation side have served to open up the criticism. There's some other, kind of misleading studies. One of them often cited by the Healthcare for the Homeless in Boston that was housing, I think, 30 people, the most vulnerable on the streets of Boston, people with cancer or heart disease. And I think 7 years later, 20 or 30% of the people who had been housed died. I don't know what level of support they had. And there's like, oh, people in Housing First die. I mean, I think I don't know, but the people who were in that particular program would have died anyway because they were quite ill to begin with when they were, taken off the streets. So there is a kind of a cherry picking of facts and a distortion of pointing to current homelessness as a result of federal policy, and it's a stretch of the truth. And the truth is that if you use the Housing First program correctly, as Rochelle eloquently stated, there are many, many thousands of testimonials that it works well when it's done well.
Can I add something, Jennifer, to that real
Absolutely.
quickly? I just want to lift up something that Sam said, which is, I I have certainly seen. I think that there is a big desire for an appreciation for housing first. There is not always a full understanding or level of resources to implement housing first with fidelity. And so, I always think about there's five core principles, I think, Sam, right, of housing first. And sometimes you have programs that maybe are able to do two or three of them, and somehow they're still considering themselves or calling themselves housing first. And so I think like we have gotten into the habit of referring to anything that is low barrier as housing first, and those two things are not actually the same. And I certainly think that has contributed to it, to some of that narrative as well.
Yeah, absolutely. And I just want to follow up on one thing. Sam, you talked about 80% versus 30, 40%. And I just want to clarify, I think the 80%, if I'm correct, is housing retention, right? That 80% of the people in the program stayed housed over a period
Yes,
of time, whereas in the treatment first housing,
right.
30 to 40%. Is that
Yes,
right?
and it's 30 or 40% for two reasons. One is it's hard to stay sober or participate in treatment when you're homeless, so people can't get in. Or, as Rochelle said, also that if you're in that type of housing that requires sobriety and compliance, if you relapse, which many people with these conditions relapse, then you lose the housing, and so you're back on the street again. Whereas housing first, if you relapse, you go to the hospital, you come back to your apartment. It's a harm reduction model, and the housing is not tied to treatment compliance or sobriety any more than it is for the rest of us.
Thank you for bringing that point out. Um, so Rochelle, as someone who has actually lived in supported housing, that had housing first principles and in housing that was not housing first, what is your take on the argument that housing first was a failure?
Housing First was definitely not a failure. As Marcy pointed out, there's a lot of other organizations and providers claiming that it's Housing First when it's not actually Housing First, because with all the services intact and the steps that Sam is talking about, Housing First is very effective. And I'm just one of the success stories of the Housing First model. But I'd like to say that I got housed in 2009. My sobriety date is 2014. So it only took me, and yes, as Sam stated, I relapsed. But I started trying right away. I just had to see, if I called them and said I relapsed or I'm having a mental health crisis, I didn't lose my keys. And that was the foundation, that was the cement for me. So within 5 years, I went into my recovery journey with my mental health and substance abuse. And drugs is just a symptom of a disease now. We have to remember that. And unhealthy people are people, each individual has a backstory. No backstory is the same. No one just said, I want to be homeless one day. The housing first model, with all the way it is practiced the way it's supposed to be, does absolutely effectively work on human beings such as myself, because I didn't lose my keys. I went into crisis centers, mental health crisis centers. I went into detox, and I just kept trying until May the 6th of 2014. I have been baseline and in recovery ever since. And because of Housing First, I was given that opportunity to make those decisions. And I think every unhoused individual coming in behind me should have me afford the same opportunities from Housing First the way it's supposed to be ran, so that they can be successful as well.
Thank you. And can I just follow up with any of you on sort of this issue of cost, right? If, I mean, housing first done properly requires more resources. I want to clarify kind of what the costs of the alternatives are if people say end up in institutions, people end up cycling in and out of the psychiatric hospital, the emergency room, the shelters, the jail. Maybe somebody can address that.
I can maybe start just talking about, I mean, because Housing First was targeted for people that we're calling the most vulnerable, that often meant that people were going in and out of hospital or in and out of jail or in and out of detox. And I think that, people generally don't appreciate what that means in terms of taxpayer costs. I mean, the hospital day, $2,000-3,000 a day, a month's stay is $60,000, which is 2 or 3 years of rent and services. And it's similar for jail and detox. And there's, even the criminalization that I think, getting more money now to police departments, court costs, and, all of these things are not as visible as what it is to fund a program. But when you change the calculus. Like one of the most well-studied groups was actually in Washington, D.C., some years ago when HUD funded a chronic homelessness initiative. And they took about, I think it was 75 or 100 people off the streets and put them into permanent supportive housing. And the University of Washington did a study of that building. It was 1811 East Lake in Washington, run by DESC, and they calculated that the savings, the offset in service utilization for that small group of people was over $4 million in the first year. But there are so many other costs, the cost of doing business, of people being in a downtown, disrupting people from using the downtown areas. I had a conversation over the weekend with somebody who works for PSCNG at the high voltage wires, 3,800, 4,800 volts, very, very dangerous work. And I asked him, what are most of your calls about? And he said, 60% of my calls are about homelessness, people trying to connect their appliances to these high voltage wires. We often find people dead because they don't know what they're doing. They've electrocuted themselves and they've blown up a section of the block because these wires feed neighborhoods. And then there's delays in getting, your electrical service because, I mean, the ramifications and the waves of leaving people to fend for themselves on the street has not only these financial costs, but I would say that there's also a moral cause and a psychological cost to all of us having to think about, are we going to give this person money? How bad off are they? It hurts to see them. I feel bad. I don't have time to help them. I'm annoyed by them. I wish someone would do something. We are all experiencing homelessness in different ways that are sometimes very visible, and we can put a dollar sign on them, and other days, just the quality of life as it affects us. It affects our children who are afraid and at the same time very sympathetic. And why aren't we doing anything? How do we continue to tolerate this? There's an enormous cost on many levels.
Thank you. So, Marcy, turning back to you, what can people do if they're concerned about where housing policy is going, and want to make sure that we don't abandon strategies that work?
Yeah, I mean, I'll be brief. I mean, I think the biggest thing is to um, the number one thing that people need to do is to talk to people making decisions. So whether that's their congressional lawmakers, their local electeds, their state electeds, uh, it's really important to have those conversations and not just go in and say housing first works, but to really be able to talk about, to be able to share stories, to have folks like Rochelle in the room sharing their stories, and be really specific about what it means. I think we've gotten too focused on using a term that in many ways has lost its meaning. Because like Sam said, people will say housing first and 10 people will say the term and they're all talking about something different. But I think if we really go into these offices and have a conversation about what people need, what works, and humanize it in a way without kind of getting into the dogmatic kind of conversations, that feels really important because I think there's so much misunderstanding. People get their news and narratives from different places. So really being able to break it down for those lawmakers so that they have the information that they need to make better decisions feels really important. And I can put also the Alliance's advocacy information in the chat. because we are always looking for folks to get involved in that way as well.
Great, thank you. And I think to your point of kind of talking about the details of like what it is and explaining it instead of using a term, there's a question in the Q&A from Jonathan Bowen Leopold, talking about those kind of details, saying permanent housing is great for people in mental health recovery instead of unfair temporary housing rules, and talking about some of the details about the kinds of supports that people actually can get and how some of the concerns, like people are going to smoke and I guess burn down their apartment or whatever, that how some of these things are actually addressed in Housing First housing. So just wanted to call out that the comment and the question was actually how can we best advocate for permanent housing, which permanent supportive housing, which is what we're talking about now. I'm going to turn to Sam. What do you see as the best way forward on Housing First implementation?
Well, I mean, at the federal level, I think the HUD-VASH program gives us a great example. We need to bring more than just HUD into the picture if we're going to be housing people that have mental health and addiction or health needs. HHS has to get involved. It has to be an interagency collaboration, and we have to actually invest in housing and services at a much, much higher level. That's really the main thing. And at a local level, I mean, some cities have done spectacular work by organizing around the mayor's office so that, for example, the business community, the police, the medics, the emergency rooms all take an approach that says we're not going to treat and release people who are homeless, but we're going to refer them to a Housing First program in our community. So instead of arresting people, people will call the Housing First program. The hospital will call the Housing First program rather than release people to the street. So it's not going to be one agency or just one organization that's going to address homelessness. It has to be done at a larger community level.
Great, thank you. And Rochelle, moving to you, how would you've talked about really the impact of Housing First on your life, but can you give us your final thoughts on what people can do to make sure that we keep what works?
We have to keep what works by keep advocating for what works. Also, you can go down to the mayor's office, DC Council. And my addition to this would be we always have the Housing First model has a peer specialist on each team, someone who's already walked through and jumped over the hurdles. And my suggestion is to keep that momentum, keep people with lived experience close in the Housing First model as they always have, and have someone to walk it with you because you do have a psychiatrist, you do have medical care, you do have a team lead, you do have life skills case managers, you do have a housing case manager. You have all of that at your fingertips to utilize while you're in a Housing First model. I think, but the most important relationship begins first is the peer specialist model. So keeping a peer in all of this is the most important, and advocacy on national and federal levels. As we know, there's not a lot of resources right now, and we have to keep going and testifying before DC Council and doing walkthroughs at the Wilson Building so that we can get them and their markups to find the money so that we can have vouchers to get as many unhoused off the street as we can, and hopefully into a Housing First model that the federal government is trying to take our voice away. We're not going to let that happen.
Thank you very much. Thank you so much to all of you. I'm going to highlight a few other questions that have come in the Q&A and the chat. There's a question in the Q&A about if there's a lack of affordable housing, would Housing First still work? If not, is there a way to adapt it to have it work in the current lack of housing? And I guess I want to point out this difference between lack of housing and lack of affordable housing. And anyway, I'm going to turn it over to whoever wants to answer that first.
Can I actually start? I mean, I know Sam probably has some things to say to that, but I want to start by um, so I think that's a really great question, and I think that's actually what has happened over the years was we didn't have that all of the housing, we didn't have all of the services. So suddenly you were calling shelter housing first. We're calling any type of program housing first when really they're low barrier, which is totally fine. Street outreach can be housing focused, and we can still be meeting people where they are, and working to engage with them when housing isn't available. But I think, Sam, and correct me if I'm wrong, the goal is uh, to not make people step a whole bunch of stones in order to get that housing once it is available to them, and to wrap around them with services. But I saw that question, and I just think it's important to disentangle kind of the values and the principles of that are embedded in the model and the model itself, because I think that's part of uh, where we've gotten caught up over the years. So I think, yes, you can still do all of the services, the low barrier, but we don't have to call it housing first if it's not in that sort of model specifically.
I agree. I think that one of the mistakes from a policy level was that HUD was pushing everything to call themselves housing first, no matter what they were doing, because they wanted kind of a more flexible approach to services, but that distorted the definition to the point where it was meaningless. So I think the idea of calling housing first a program rather than an approach, and having all this confusion about it would be a good way to begin to roll that back, and understand housing first as having these criteria, and that's what it does. And outreach is outreach, and housing first is really permanent housing with support services. And can we do housing first without housing or affordable housing, as you said, Jennifer? No, I mean, yes, we can for the small number of people that are on the street today. But if we're going to end homelessness as a country, we need a lot more affordable housing, like public housing. That's what, most countries in Europe and Canada and everywhere else are doing. They're expanding their portfolio of social housing or public housing. For the group that we've been talking about, we will also need case management support. So everyone who's homeless needs affordable housing, but some people will need home visits and care once they're housed. We don't need to build special housing or this type of housing or that type of housing, just housing that's affordable. And for some people, lots of support. Some people eventually will need some kind of assisted living or need to live in group homes. And, that's a different story. But I think this idea of like building permanent supportive housing for 20 people or 50 people or 100 people, one at a time, very expensive, has not gotten us anywhere near where we need to be in terms of affordable housing. We've only built 350,000 units in 30 years of doing this. We need 300,000 units a year, every year, as public housing. There's a tremendous housing shortage. So yes, of course, we cannot do housing first without housing, but housing first is not housing only. For that group that needs housing first, we need the services.
Thank you. And I think we probably have time for one final question. There are two questions in the chat that are basically similar. Is there a toolkit that exists that we can use to speak to lawmakers? Can it be shared? And then someone else asked, could you provide us with more information about Housing First? So I'm going to turn it over to you all to talk about what exists.
Well, I'll put our website on there. We have a lot of information and resources about what the program is, and manuals and videos and all of that. As far as the advocacy, I think probably the National Alliance.
Yeah, I'm going to put our link right there for how you can get involved in our advocacy, like Rochelle, who partners with us all the time.
Yes.
Great. Well, thank you all so much. I'm going to turn it back over to Sid to close out, I think.
Thank you for having us.
Thank you.
Yes, thank you to everyone for attending the webinar today. And of course, big thank you to Jennifer and our panelists for sharing your thoughtful insights. This is such an important and timely topic, and it just is really great to have you all here. Thank you to our interpreters and to the Lurie Comms team behind the scenes keeping us on course. Um, please keep in touch with the Lurie Institute, and we have our email and some of our social media links. And please don't hesitate to reach out to us. And we intend on sending a resource about this, what was covered in this webinar, out to registrants. So keep an eye out for that. Thank you again to everyone for joining and for being with us. And I hope you have a great rest of your day.
I have an amazing day.
I think